The Omicron variant is a game changer in this pandemic, swamping many of the policies we have relied on to stay safe these past 2 years, such as testing and tracing, isolation and quarantine. The pressure is now on for governments to set out a new framework for living with COVID, both in terms of public health policy and in terms of dealing with the swathe of illness and uncertainty cutting through the economy. National Cabinet is now back to meeting once a week in the face of the renewed crisis. On Wednesday, it will consider questions of concessional access to rapid antigen tests and an update on vaccine supplies. But as we have just heard from the head of the AMA, there is intense criticism of how governments, particularly the New South Wales government, have been changing their COVID policies. For a long time, the ambition of public health policy was COVID zero, or something very close to it. It saw the nation dubbed Fortress Australia, or the Hermit Kingdom. That's meant for the past 2 years our international borders and sometimes state borders have been closed, whole cities and regions have been locked down, and we have relied on the so-called TTIQ regime: test, trace, isolate and quarantine. In recent months though, the crucial test of the management of the virus has changed.
The goal here is not to have no cases. The goal here is to ensure that our public hospitals and our health systems are able to cope with this virus so we can live with the virus.
When the Omicron strain of the virus first emerged overseas in November, the initial response by the federal government and National Cabinet was to try to keep it out of the country. Plans to open borders to migrants, including international students, were delayed.
And now Omicron is here.
There were only a handful of cases in Australia by the time National Cabinet met on November 30, but the states and the Commonwealth decided to press on with a formal shift from a policy of elimination to suppression, emboldened by high vaccination rates. The PM started talking up the future.
We're going into 2022 looking through the front windscreen, not through the rear vision mirror.
Even without knowing just how fast Omicron spread, however, there were already questions about whether Australia was responding fast enough to accelerate the vaccination booster program. But by December 10, National Cabinet confirmed that the central architecture of our public health policy response to COVID of the past 2 years was starting to unravel. It decreed that the test, trace, isolate and quarantine measures, alongside public health measures such as mask wearing, remain key to ensuring cases remain within clinical capacity. But unity about these measures had already started to break down. The most aggressive easing took place under the new New South Wales Premier Dominic Perrottet, abandoning masks and QR codes among a range of other restrictions lifted with the aim of opening up the state. Perrottet told people to go out and spend, head to the pub, get back to normal. That living with COVID now was a matter of personal responsibility.
Go out and support your local businesses. You know they've been doing it tough.
He got powerful backing from the PM.
None of these restrictions belong in the lives of Australians. Australians don't like it. I don't like it. Australians kept their side of the deal. And it is now time for governments to keep theirs, to put Australians back in charge of their own lives.
It was not to last. On December 22, the top public health advisory body, the AHPPC, pointedly reaffirmed the importance of face masks. Significantly, it said masks should be mandated in all indoor settings, including retail, hospitality when not eating or drinking, and entertainment facilities.
Would you like to see all premiers, particularly the New South Wales Premier, make mask wearing mandatory?
Well, there'll be decisions that they take in each of their states and territories. We don't have to mandate people wearing sunscreen and wearing hats in summer.
If I don't put sunscreen on, you're not the one who gets sunburnt. That's the difference here.
The next day, New South Wales announced the reintroduction of mandates for masks and QR check-ins. By this stage, it was becoming clear the problem wasn't just the impact on the health system of Omicron, it was the huge numbers of staff in businesses who were either getting sick or having to isolate, people staying at home for fear of catching COVID, and travel being cancelled. Also, travel test requirements were adding to overwhelming pressure on the testing system.
If you don't need a test, please don't get one, because that also delays the turnaround time.
24 hours later, on Christmas Eve, ATAGI recommended reducing the minimum period between the first 2 shots and the booster shot from 5 months to 4 months as soon as practical, noting the holiday period. If practicalities allowed, it said, boosters should be available from a minimum of 3 months. With numbers surging, National Cabinet met again last Thursday.
We need to reset how we think about the pandemic and how we manage ourselves and the things we need to do as governments.
Most significantly, the definition of who is a close contact, how they are isolated, and the testing arrangements they should face was changed. The PM announced there was a new definition of close contacts, with a message going out that only household contacts exposed for 4 hours needed to quarantine for 7 days.
If you don't fulfil this definition of a close contact, then there is no need for you to be in that line. You should go home. Go to the beach. Go and do what you want to do. Read a book in the park.
In fact, this was not what the advice from the experts had been. There had been no reference to 4 hours exposure.
We're not using that 4 hour, that wasn't something that we'd discussed at AHPPC, and it's not in the document that certainly I was involved with. But, I'm not at National Cabinet.
While the committee had put the focus on households, it also said workplaces or venues that had seen significant transmission events should also be considered close contacts and therefore forced to isolate. The significance of these changes, though, is that businesses and workplaces don't have to stand down staff who may have been exposed to the virus but are not showing any symptoms. Requiring only a rapid antigen test done at home at the end of 6 days also means state bureaucracies lose clear sight of case numbers and prevalence in different communities.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.